In this video, we are going to look at arthrokinematic assessment and treatment for the dorsal capsule of the shoulder. Get our very own assessment ebook and mobile app. Links are in the video description. Hi and welcome back to Physiotutors. The aim of roll glide assessment is to gain information on reactivity of the joint and of course articular problems such as capsular limitations. For this assessment, the patient can comfortably lie on the unaffected side while you stand behind them. Ask the patient to place the hand of the unaffected arm over the pectoralis and against the coracoid process in order to stabilize the other shoulder girdle during this mobilization. If possible, you can pre-position the arm in internal rotation with slight abduction and grab the patient's forearm as a lever to induce the roll component. Support the arm at the elbow with your other hand and place your forearm over the anterior aspect of the humerus. While you induce the anterior roll component with one hand, the gliding component is added by your forearm into dorsal lateral direction. If end-range internal rotation cannot be achieved by the patient, have the patient lie in supine position and you can slightly abduct the arm to stand between the patient's thorax and the arm. Grab onto the patient's arm above the elbow with one hand and place the base of your other hand on the humeral head. Then induce an anterior roll with the hand above the elbow and glide dorsolaterally with the other hand. Another alternative is to perform horizontal adduction in supine position. The patient's arm is in 90 degrees of flexion and 90 degrees internal rotation. Induce the anterior roll with one hand at the elbow and glide dorsolaterally by applying an axial load to the humerus. Use your other hand to apply lateral traction on the humerus. Assess for movement quality during roll and glide, possible pain provocation and end feel. For end feel assessment, roll and glide to end range. Then assess if further gliding is possible or not. In a hypomobile joint, the glide is reduced relative to the roll component, so no further gliding is possible. If you feel that the end feel or movement quality is abnormal, you can directly move further from assessment to intervention, as the movements that are performed are essentially the same. When used as an intervention, make use of the Maitland grades of mobilization to dose your techniques. Check the video in the top right corner to learn more about those concepts. Alright, you've reached the end of the video, and if you like, you can check out more videos on manual therapy in the playlist to my left. Again, check the info icon in the top right corner for the featured videos and also take a look at the links in the video description. At last, subscribe to our channel if you haven't yet. Hit the bell next to the subscribe button to get notified once we upload new videos. And as always, thanks for watching. This was Andreas for Physiotutors. I'll see you next time. Bye.